Hello and welcome to AXA Health Chats. I'm Jan Vickey. I'm proposition lead here at AXA Health and a physiotherapist. And I'm joined by my colleague, Juliet Loudon, who is a physiotherapist who is very clued up on all things musculoskeletal. Today, we're going to be talking about muscles, bones, and joints, and in particular, how that affects us as we get older. Shall we start then and talk about how age affects joints?
Mm-hmm. Absolutely. So as we get older, naturally we get wear and tear. Same way we get grey hair, wrinkles, it's a natural part of aging. But depending on, say, lifestyle, it can impact the state of the joints at an earlier time in our lives. So with aging, we see less cartilage, more sort of degenerative changes within the joint and the bone, less flexibility within the joints, and often accompanying that as well, we'll see a lot of muscle weakness developing as we get older too, which will have a knock-on effect on the joints as well.
Yeah, and I guess what people have got up to in their life will also impact how people age in both good and bad ways.
100%, absolutely. Yeah. We can relatively control how quickly we age depending on our lifestyle. So how physically active we are, what we put into our bodies in terms of diet, our jobs in terms of are we sitting all day, that affects the joints. Have we got a very manual job, that will affect the joints as well. So depending on that balance will depend on how quickly our joints will degenerate.
Yeah. So people do tend to think of aging affecting joints, but what about muscles and bones themselves?
So again, naturally, as we age, in terms of muscles, we do tend to lose muscle mass a lot faster. Just that gradually accelerates as we get older, as well as bone density as well. So that will, after about the age of 25 to 30, we kind of reach our maximum bone density, and then it will start to decline as we get older. Again, that will also depend on our lifestyle in terms of weight-bearing activities. Bone density in terms of our diet, certain things that we have in our diet can help with bone density, or if we're lacking certain nutrients, that will accelerate the loss of bone density.
Shall we then also move on to talk about conditions that tend to feature more as you get older with muscles, bones and joints?
Yeah, I mean, probably the most common one that a lot of people will get as time goes on is osteoarthritis. Often just shortened to arthritis, but when we say osteoarthritis, that is the degenerative changes in the joints rather than other forms of arthritis you can get that are more autoimmune based. So your osteoarthritis is where we see degenerative changes in the joint and an increase in inflammation as well, which will also then accelerate that degeneration in the joint. Most commonly, it'll be knees, hips, and there are a lot of things that we can do for that. It's not a case of we've got arthritis, we need to replace that joint. We can slow down that degenerative process with particularly physical activity, but there are other things that we can do as well. And it can exist without you having any pain whatsoever. A lot of people will have it and not know it. It just happens to be picked up through some other means. But it's very normal, and it's not always necessarily a painful condition.
Yeah, I think often when people hear that they have arthritis, they're scared by that, but emphasizing that it's just normal wear and tear is quite an important thing for people to understand.
100%. Like, aches and pains are normal as we get older, but you can scan my body and find lots of wear and tear in my joints. It's very normal. It's not doing anything. It's just when it reaches a certain level of severity, you might notice it. You might notice certain aches or a loss of flexibility coming into play, but again, it's not a given that that's it. We know that a lot of people with osteoarthritis tend to also have quite a lot of muscle weakness around, which ties in with aging as well, but that is something that can be rectified through physical activity. So the stronger your muscles are around joints, the more support they have, the less stress going through the joint, the less inflammation, the less pain. So it's not the death sentence people seem to think it is.
Yeah. And I think also to emphasize that whilst arthritis is something that affects joints, actually what's happening with your bones and your muscles is extremely important as well, because they're all interlinked.
Oh, massively as well. So we know that having reduced bone density will also accelerate the wear and tear within joints as well. And yeah, I say less muscle strength will mean more force going through the joints, which also accelerates that. So it's not just the joint, it's what the muscles, what the bones are doing as well.
Yeah. And it can become quite challenging to navigate movement because we know motion is lotion, we often say as physios. Yeah. So really important to keep moving, but hang on, if I've got pain, how do I find my way with that? So what do you say to your patients when they get caught in that conundrum?
So yeah, pain can be quite counterintuitive. So pain is usually it's a message to tell us that there's the potential for tissue damage, but it doesn't always mean that there is damage going on. So often it's more of a warning sign. So with our typical patients, usually a low level sort of discomfort, low level pain is usually okay. We can exercise through that, and actually tends to be the more we move, the more we exercise, the less that pain gets. Actually, higher levels of pain, say if you're talking a 0 to 10 out of pain, anything above probably a 4 or 5, you'd say that you may be pushing it too much. We need to be working more within that 0 to 4 kind of out of 10 pain scale. But actually, often it can be really difficult to begin with because it is sore. It's very disheartening when you try to exercise and it's painful. You don't want to do it again. But actually, the more we do it, the less painful it gets, and actually the more confidence you get as well. Like, I think when you expect something to hurt, it tends to hurt. So it's very difficult to change that mindset until we challenge it, if that makes sense.
Yeah. And I think if you have the reassurance of someone who knows about arthritis, who can give you the guidance, that helps in the confidence.
Absolutely. I think a lot of people just don't know where to start and don't always know who can they ask. So, I mean, being a physio by trade, we're the natural ones to go to. There are other health professionals that can help as well, but this is our bread and butter. This is what we see every day, and we help a lot of people with it. I say the amount of people that are, have a really sore knee or hip and just go, well, I probably need a joint replacement now. Most consultants won't go anywhere near you with a scalpel until you've gone and done physio first.
Yeah.
Because a high proportion of people will go and do their prehab, which we know will make any surgery a lot more successful. But actually, they often do the prehab, so they do all the strengthening work, they improve the range of motion, and go, actually, it doesn't hurt as bad anymore. I don't need the surgery. Yeah. Or we can delay it several more years, which is what we always want to do. You never want to have a joint replaced too early, just because there is the chance you might have to go in and do it again. And when you're that bit older, there's higher risk associated with that. So we really want to preserve our joints for as long as physically possible.
Yeah. And I think just even knowing and being able to think positively around exercise helps. So if you have in your mind, if you imagine that motion is lotion, and you can imagine your joints being bathed in the synovial fluid, and actually you moving, doing that, it helps to visualize and to not worry about doing damage when you're moving.
Absolutely, yeah. Like, I mean, the joint fluid, your synovial fluid, that only gets spread all over the joint surface if you move it through its full range. So if we're constantly working in a small range of motion in all our joints, bits of the joints are getting neglected. But the way I think of it is like putting WD-40 on it. It nourishes it and it makes it last longer. Whereas if we're not moving our joints, they wear away faster, essentially. If you don't use them, you lose them.
Yes, yeah. We've got lots of those catchphrases, haven't we?
I love them. I'm a sad physio that way.
The other thing that we hear often, but it becomes really, really important with aging and managing the effects of aging on muscles, bones, and joints, is that if exercise were a pill, it would be a miracle cure. So again, if you think of popping your pill every day in the form of doing some exercise, that is having a significant positive effect on your muscles, bones, and joints.
Like, I mean, and also just taking the pill, that's always like one targeted thing, whereas actually exercise has a wealth of extra benefits in terms of just your cognitive. I think it's a much better understanding. A lot of people get now that actually exercise is good for their mental health.
Is it worth talking a little bit more around that association with mental health and to unpack that a little bit? Because it, as you said, we know it's a big feature that exercise makes us feel better. How does that work?
I mean, on a very fundamental level, we're still working that out, but we know that it makes people feel better within themselves. It boosts various chemicals in our brains, so things like dopamine, serotonin. So we know that this is actually a means people that they use for managing things like depression and stress. I say the amount of people that I know run to help control their stress. I'm probably one of them, to be honest.
Yeah.
Because it's a really, it's a very healthy way of kind of getting rid of that nervous energy, moving our body, which is what we're designed to do. When you think we've evolved to be hunter-gatherers, that's what we're designed to do, is to be on the move and using our bodies all the time.
Should we talk a bit about what the things are that could exaggerate the effects of aging on your muscles, bones and joints?
Yeah, I mean, the biggest one that I'm sure doesn't come as a surprise would be physical inactivity. When we're, a lot of jobs revolve around sitting all day, and then we sit and watch TV in the evening a lot of the time. When we're sitting, our muscles aren't working, or to a degree. Sometimes when we're sitting at a desk, our muscles are working, and they're actually having to work harder in some cases to stop us just collapsing against gravity compared to being up and moving around. So people can actually get a lot of muscle soreness from sitting, as well as weakness in other muscles. So certain conditions like osteoporosis, a lot of people will have heard of that, more common in women and more common the older we get. Osteoporosis, that can exaggerate the wear and tear in joints, we know, and that, there's some things we can't change, like our gender, like our age, but things like in terms of our diet, how much sort of calcium, vitamin D, protein we have in our body, that can impact on our bone density as we age and slow the loss of bone density. And again, also doing sort of weight-bearing physical activity can also help with that. Exercise, when we get older, it's better to have more of a influence from things like balance and muscle control rather than high impact, say, because we know that falls also are a huge risk as we get older and can be quite catastrophic in terms of people's quality of life and level of function. So the more people can exercise, the better their balance is, the less likely we are to have falls, and therefore all the repercussions that come along with that.
Yeah. And perhaps usefully, it's the same things, those lifestyle factors that are important for other aspects of health that are important for physical health.
Mm-hmm, absolutely. I think I think a lot of people know that we should be cutting back on alcohol consumption, maintaining a healthy weight, exercise regularly, stop smoking. I think we all know these things, but it's difficult to actually act on these sometimes when we've got so many other things going on in our lives. So it's it's helpful to kind of understand, well, why are these things important? We know maintaining a healthy weight, there's literally less force going through your joints, therefore less inflammation, less stress, less wear and tear.
So the other thing, of course, as you get older, that's relevant to women, and I can speak about this personally, is the effect of menopause. And although not all women are affected the same, and some people have a much easier time than others, it really can affect how you are physically in terms of strength and motivation to move around, and of course hormonally what happens to your body and how that can amplify or speed up some of the effects of aging.
Yeah, no, absolutely. There's a wealth of changing hormones that come along during the menopause, so it seems to vary quite a lot person to person in terms of how it affects them. A big one in terms of the loss of estrogen does have quite a significant impact on bone density. So the most common people you will find osteoporosis in tends to be postmenopausal women. Doesn't mean that men can't get it, and they do get it, but it's just not as common. And so with that drop in bone density, it makes sort of frailty fractures so much more prevalent, and they can be quite catastrophic in their impact. But by the same point, changes in hormones can amplify other things going on in our body. So we tend to actually have a lower pain threshold. People tend to find when their hormones are in the process of changing. It seems to have quite an impact on a lot of structures that, again, we're still learning about. But I know that if I'm speaking to someone who is having the aches and pains, back pain, it's not unusual it wouldn't be far-fetched to assume that actually the change in hormones is also amplifying their pain and dysfunction, and mood as well, because also a lot of people do suffer from low mood during changes in hormones, and again, it's very difficult to motivate yourself to be healthy, to go and exercise if you're not feeling great. We do know that actually counterintuitively exercise does help with that, but it can be quite a barrier for people to get over, particularly if they're maybe not used to doing a lot of exercise.
Yeah, and the one thing that I found myself was the importance of tweaking the type of exercise that I do. So I've always been a runner, but actually I found it's become more and more important to do strengthening and to focus more on strengthening. which is a completely different mindset that I have to adjust to, but really see a much more beneficial impact on the strengthening bits.
Yeah, sort of strength resistance training is so beneficial in terms of strengthening your muscles and therefore provide a lot more kind of both muscle control but support through our joints and our bones as well. Impact, things like running, it's not out of the question if you're already a runner. So there are people that are still running marathons in their 70s and 80s and are not that far off the optimum times. But naturally, I think it's something that if they've always done that, they will have had a good bone density throughout and a much slower decline in that bone density. So if, say, you're someone who's never really done much in the way of, say, running or high impact training, you're usually better starting with resistance training because it tends to be more beneficial as we get older.
Yeah, and specifically postmenopausally and for age, the recommendation for strengthening is quite strong.
As well as things like your ones that help with coordination and balance as well, because our balance tends to decline as we get older, but that is something that can always be retrained. So things like yoga, like Tai Chi, Pilates, because all will help with your core stability as well, which, and a lot of people say with chronic lower back pain, which is not unusual as we get older, people with chronic back pain tend to have very weak cores, so there's a lot less support for the spine, and a lot of the other muscles then have to work double time to try and compensate for that, and then we end up with a sore back among many other things. But yeah, with better core stability and overall balance, again, we're less likely to fall or hurt ourselves.
I'm very aware that as physios, we're talking about exercise in the form of running and Pilates and yoga and that sort of thing. And of course, there are a lot of people that does not appeal to. Not everyone does that sort of exercise. So is it worth talking a little bit around what people can do in the name of exercise that isn't a dedicated type of exercise that we've been talking about?
Yeah, I mean, the one form of exercise that is accessible to the vast majority of us and is free is walking. Going for a walk, it's low impact, but it's still working our cardiovascular system, still working our strength. It can be very social, and it's something that actually as human beings we're very well designed to do. And so it's something that, again, you don't need to necessarily carve out a lot of time for it. You can make it part of your commute or part of going going grocery shopping. At the end of the day, for exercise, it needs to be something that you do enjoy.
And you touched on something there that I think is another important point, which is if you can find a way to exercise that is habitual. And again, people are so creative with this. Have a little dumbbell next to your kettle that you just do some curls while you're waiting for it to boil. That sort of thing. If you can build it into everyday activities, that makes it easier as well. Should we talk about some of the top tips for people as they age?
The big one I would say is moving on a regular basis. Not to say that you have to spend your day walking all day. I mean, actually, the one thing I often tell people to take away with them is just the best posture is the next posture. So as long as we're moving and changing position, doesn't mean you have to go and run a marathon between phone calls at work, but it's just regular movement is one of the simplest things that you can do. One thing I often do is actually I keep a lot of certain things like my phone, like if I don't need it, I'll put it in another room. So if I want it, I've got to get up and go get it. Or sometimes I'll put it upstairs, much to the annoyance of people trying to contact me. So the more opportunity you can have to move, the better, really.
I think the other really important thing as you age is to learn to pace and take breaks. And I've certainly found this, regardless of what you're doing, if you're in the garden, if you're doing DIY, shopping, at a concert, standing up, if you keep going for prolonged periods of time, you do find it harder. So it's really anticipating that fatigue and stopping and breaking, and then picking up again, because you do recharge and recover.
So it's trying to have a think, how long can I normally do this for before I get tired or painful? Try and go, right, okay, if I stop when I feel okay, so whether that's 10 minutes beforehand, that can make a real difference and mean that actually you tend to achieve a lot more and can still enjoy the process rather than having pain kind of dampen that or fatigue.
Yeah, because ultimately what might happen is you push beyond that boundary then you're dealing with inflammation, and then you can't actually do whatever it is that you're doing for a week or two while you wait for that to settle. So it is learning to live with your body as it gets older. Should we touch on some of the misconceptions and weird ideas people get sometimes around aging? What are some of the big ones you deal with as a physio?
Probably the most common one would be that, say if I've got back pain, well, I need to rest, I need to lie in my bed, just don't move for 7 days kind of thing. Whereas we now know that is the worst thing you could possibly do. What we find that most people with lower back pain tend to get better a lot faster with what we kind of call active rest. So it's not going out and running a marathon to cure your back pain, but it's just little movement and often. So just getting up and pottering about. So a lot of people will be like, well, I'm just working in my bed today. I'm like, no, get up, walk around, go, say, boil the kettle. Just little movement and often actually will make you better so much faster. And things like taking painkillers. A lot of people don't like taking painkillers, and I can understand why, but your very simple over-the-counter ones can actually be really helpful. They don't cure the pain, but they make you more comfortable, which makes you more inclined to get up and move around, because if you're really painful, that's the last thing you want to do. But actually, if you're that bit more comfortable, you move that bit more normally, that really accelerates you getting better faster. Whereas if we're very braced and barely moving normally, it's going to drag out so much longer. So I think people can be very against taking painkillers, and for good reason in a lot of cases, but they can be really helpful in facilitating the recovery from things like, back pain or joint aches, those types of things.
I think another one that we hear of quite often is the response to people having perhaps had an X-ray and be told that they have degenerative conditions. Or often they are clinical terms that perhaps a doctor might have repeated to them. And sometimes people pick up on little things that then scare them, and it becomes an unhelpful belief that they then follow.
Absolutely. I mean, I think it's one of the reasons why GPs don't tend to just automatically refer everyone for x-rays when they come in with joint pain, because they'll always find something, whether it's relevant or not. So I think it's important to remember that imaging, like x-rays, like MRIs, they're just part of the picture, because there's always something. You could scan my back and find multiple bulging joints, loss of disc height, degeneration here, there, and everywhere. But that's fine. I don't have back pain. It's very normal. People can really scare themselves and actually give themselves back pain when they happen to be told, oh, you've got wear and tear in your spine. And actually what we believe and how we think about these things can actually then produce pain, because it changes our behavior. So suddenly someone isn't going to move properly because, oh, I've got wear and tear in my back, I shouldn't move my back. And then it actually gives them back pain. So I always say to people, always take the results with a pinch of salt, because it's just part of the clinical picture. It's not necessarily giving us the answer here.
I think the other thing is, as you get older, you will have more niggles. It's just a feature of getting older.
So normal. And
you just have to respond to that and move on, carry on. If it's still bothering you after a long period of time, you've got a lot of inflammation, so redness, hotness, swelling, it might be that seeing someone to get a bit of help and advice would be a sensible thing. But in the main, you can deal with your niggles and aches and pains. People know their bodies, don't they?
Absolutely. I think I always say, you know your body better than anyone else. Is this a niggle that's normal for you? Is it not? And it's just taking that into account. But things like, there are actually so many things that we can do ourselves that actually a lot of people, if I'm speaking to them on the phone, I go, well, this is what I would tell you to do if I had you in front of me. We know that with, say, muscle aches and pains and backs, we know that heat tends to work really nicely for that. So whether it's getting a hot water bottle on your back or spending an extra 10 minutes in the shower. Some people find that alternating between hot and cold works better for them. I personally don't, but others do. It's kind of whatever works for you. And naturally, if you roll your ankle and it's twice the size and swollen and hot, ice would be preferable. But it's just working out, well, what kind of is the problem, what works for you, because different people use different things.
Yep. Thanks, Juliet. That's been really interesting to speak to you today. We've covered quite a lot. We've talked about aging, muscles, bones and joints, misconceptions around aging. We've also spoken about what happens as you age, conditions that affect you, top tips on how to deal with it. It's been great.
Yeah, no, I've had a great time.